Ni hao, Jojo. Washu, Dr. Brower. How are you? That is a very interesting question. Now, first of all, we should talk about how common are liver cancer and stomach cancer. Believe it or not, throughout the world, they are the number 1 and 2 causes of death from cancer across the globe. That's a staggering number, and as you may know, these diseases are most important in all Asian Pacific Islander individuals. So let's talk about liver cancer first. In Asia, hepatitis B is a major cause of disease. And hepatitis B is a silent problem that causes damage to the liver. And over the course of a number of years, patients with hepatitis B can develop tumors in their liver. So hepatitis B, which is present in 1 in 10 Asian individuals, is a risk factor for liver cancer. Now let's talk about stomach cancer. Stomach cancer, as you all know, is very, very common in Asia, and perhaps some of you and your families have even had individuals with stomach cancer. We now know that stomach cancer is caused by long-standing inflammation called gastritis. And in Asia, there is a bacteria that resides in 90% of the stomachs in Asia called H. pylori. And this little bacteria, although it doesn't cause a lot of indigestion and stomach problems, can cause an ulcer, and it can cause inflammation that leads to stomach cancer. So the important thing is to recognize with liver cancer and stomach cancer that we have to diagnose hepatitis B and H. pylori infection, and secondly, how we treat these two entities to prevent cancer. Now, we said that stomach cancer is very common, but stomach cancer can be diagnosed very, very early. And this happens frequently in Asia because the Asian doctors are familiar with the high level, the high risk of stomach cancer. They perform procedures that can pick up stomach cancer early. The way in which we pick up stomach cancer early is through what's called an endoscopy. This is a light on the end of a tube that goes down into the stomach, and then biopsies, small pieces of tissue are taken to rule out the presence of stomach cancer. Once these biopsies show stomach cancer, then that patient needs to be treated for stomach cancer. Now, in Asia, because we screen so many individuals, we can find early gastric cancer. A lot of patients then come to live in the United States of America. I myself, who am a stomach cancer expert, had an office in Chinatown and Flushing. In those areas, and in fact throughout the United States, many doctors know how to screen for stomach cancer. It's done early, and we can pick up these cancers at a very early stage. If we can pick up stomach cancer in its earliest stages, then we can cure 90% of these patients. If we cannot find stomach cancer early, then the risk of more advanced disease and lower survival is greater. And there are various other ethnic groups in the United States, such as Caucasians, African Americans, Hispanic population who present perhaps with later stage disease, and their survival can be less. Now, I want to caution here that not every Chinese individual who presents with stomach cancer presents at an early stage. So they need to be screened early, followed very carefully, and if they have stomach cancer, they need to seek treatment. One of the most common questions that's often asked of me as a stomach cancer expert is, what can we do in our lives to decrease the risk of stomach cancer? And perhaps the most important question is, does diet affect stomach cancer in Chinese individuals? And there is some data that suggests that the way food is prepared in Asia can elicit some kind of carcinogens that can cause an increase in stomach cancer. So the way in which some meats are prepared, the way in which some of the soups are prepared can elicit some kind of chemicals that are in the foods that can cause cancer. It's also postulated that there are some funguses that grow in various vegetables that can increase the risk of stomach cancer in Asians. But I want to caution that as compared to things like H. pylori infection, the bacteria that we spoke about before, the risk from environmental causes such as food and other naturally occurring causes is much less. So although one needs to be somewhat concerned about the preparation of chemicals such as nitrosamines from smoked foods and other foods, it's not as important as the major risk factors for stomach cancer. We are very interested in the screening for liver cancer and stomach cancer in our Lefcourt Family Cancer Center at Englewood Health. We utilize the most up-to-date technologies in association with standard endoscopy, for instance, to look for stomach cancer. We actually can perform techniques that find the earliest changes in the lining of the stomach by looking at the blood vessels and capillaries with various dyes that are in the lining of the stomach, and can see the earliest changes before a stomach cancer arises. If we find these changes, our gastroenterologist can perform what's called endoscopic mucosal resections or endoscopic submucosal resections, where they can actually remove these early lesions before they turn into cancer. In addition, with respect to liver cancer, within the operating room, we liver surgeons are using very specific ways to localize with green dyes, with fluorescent dyes, the earliest type of changes in these liver tumors, so that we're able to remove just the tumor and spare the normal liver. In addition, at Englewood Health, we are proud to be the recipient of a grant looking at screening for higher risk populations for hepatitis in our emergency room. This is not being offered at any other areas other than a few places, so that we're able to identify high-risk individuals, such as an Asian-born individual who is now living in our own Bergen County here of New Jersey, to screen for these patients. And if they're found to be a hepatitis carrier, then we can treat this, then we can follow them appropriately to detect early liver cancer. So the news today for the early determination and detection of stomach cancer and liver cancer in Chinese individuals is really good. And we have the highest level technology and expertise in caring for these wonderful Chinese American patients with liver and stomach cancer. So thank you, 谢谢. And we want to say to everyone,
再见。